Hi, okay, so today we've got this entire room to ourselves. The weather is nice, and I decided to finally record a video. Got some time to do that. And the topic that we'll be covering today is going to be these muscles over here, and these are called the muscles of mastication. And this video, I'm actually recording it from my front camera, so maybe the quality is not that great, but I can actually see what I'm showing in the camera. So hopefully things would not go out of focus and things would not go out of frame and everything would be fine and good. So let's begin. What can we talk about muscles of mastication? So the muscles of mastication, as the name suggests, that the muscles of mastication are the muscles that would be required for a person to chew. So to chew their food or to open their mouth, to close their mouth. So it aids in speech, it aids in mastication, that means chewing. So these muscles are going to do that. So it's not going to be a long video because there's just four muscles, and those muscles are sensibly named. If you know your basic anatomy and your bones of the skull, then you will actually be able to identify these muscles and actually be able to guess their point of origin and insertion, which we don't call them now. We call them proximal attachment and distal attachments. So the first muscle that we have over here is this muscle. This is called temporalis. Makes sense, right? Because the bone from which they would be arising, that's the temporal bone. So this muscle right here is called the temporalis muscle. And as you can see on this skull, that this is originating or has a proximal attachment from the temporal bone. And if we were to remove this muscle, we would see two lines over here. If you remember your basic bones of the skull and their important landmarks. So we have a supratemporal line or superior temporal line and an inferior temporal line. So this muscle arises from mainly the inferior temporal line, which is hidden beneath this muscle over here. So this muscle temporalis is going to originate from there, and then if you can see, this muscle is then coming over here behind or deep to this bone. This is the zygomatic arch. So it's deep to this bone and then it's inserting onto the mandible. And the deeper part or the medial side of the ramus of the mandible. So this portion is the lateral side, which you can see or palpate. And the area that this temporalis is going to, this is the medial side of the mandible. But which part of the mandible? This portion, laterally and medially, this entire part of the bone is called ramus of the mandible. So on the medial side of the ramus of the mandible. But the thing to note in order to guess its function is that this muscle inserts or has a distal attachment on this bony part of the mandible. So this is round and is sensibly named. This is the coronoid process of the mandible. So we have the coronoid process over here, right? So this is the coronoid process. Part of this muscle attaches or inserts to this part, and then it continues further down the ramus of the mandible. This part of the ramus is called the anterior border of the ramus. So it attaches all the way to the anterior ramus or anterior border of the ramus till the alveolar ridge. So alveolar ridge starts from here. That is the part of the mandible in which your teeth are. So your last tooth, which is most likely the third molar if a person has it, or a second molar, which is usually in everybody. So it attaches distally to that very point where you have your last standing tooth, right? So if you can see over here, this entire muscle is the temporalis. Okay, now if you were to guess its function, so the way that I teach my students to guess the function of a muscle is that most of the times, so a muscle has probably two attachments, right? A proximal attachment, the origin point, or the distal attachment, the inserting point, right? So one of these points is going to be stationary or static or fixed, and the other part, most likely the distal attachment, is going to be the movable part. So which part is going to be moved? Obviously it's going to be the distal attachment because that's being attached to that part of the bone which can be moved. Sometimes two bones can be fixed, but relatively one would be more movable than the other. So if you were to see this muscle over here, right? So as you can see on this model that we have fibers and their directions, right? So these fibers, the anterior fibers, these are going to be more vertical, right? So they would have a function which would probably relate to their vertical orientation. And these fibers over here, these are more horizontal, right? So if you were to guess this muscle's function or these fibers functions mainly, so temporalis and primarily its anterior fibers, so the fixed point is this bone, right? The bone of the skull cannot be moved. So this point cannot be moved, but the mandible is the movable jaw. So it can be moved, it can be opened and closed, and etc. So when this muscle would act, it would actually pull the mandible. It cannot pull the skull down, but it would pull this mandible where? Upwards. So this would cause elevation of the mandible or flexion of the mandible, if you are aware of those terms. But in terms of mandible, we call it elevation of the mandible. So this would close the mouth, this would elevate the mouth, this would flex the mouth or the lower jaw or the mandible. So temporalis and primarily its anterior fibers are going to elevate the mandible. These posterior fibers, because they're horizontal in orientation and direction, so if you were to guess its function, I want you to take a minute and guess that these fibers, because they're horizontally oriented, what would they do to this bone, this mandible? You probably guessed it correct, that if they're going to pull it, because this point is posterior to this point, as in behind this point, so that means since this cannot be moved, this would be moved towards this point. So that means these fibers are going to pull this mandible back. So they're going to pull it back. That means that they're going to retract the mandible or retrude the mandible or pull the mandible back. So temporalis is actually the primary retractor of the mandible. This comes as a question usually because not a lot of muscles retract the mandible. It's mainly and primarily the temporalis muscle that is the primary retractor of the mandible. The other muscles, they either protrude or they open the mouth or close the mouth, but this temporalis is the primary retractor of the mandible. And see how easy it was to guess the function, because if you look at the fibers, just remember that whenever you're studying a muscle, look at the muscle, closely and clearly, and then look at those 2 points. Which one of those points can actually be moved and which one of them cannot be moved? So you can actually guess the function yourself, and then anatomy becomes just a tad bit easier, and that's what I'm here for. So we're done with the first muscle, and that is the temporalis. Okay, made the lighting a little bit better, and also I just realized that there's some noise in the background. That's basically the blinds in this room, and I tried to fix it. Hopefully it worked. If it did not, I apologize for that extra noise, but I can't really help it. So the next muscle that we have, which sadly has been removed or torn by the students over here, should have been the masseter muscle, which is not over here, and that is your second muscle of mastication. So, but we can still talk about it. So the muscle of mastication, it comes or originates or has a proximal attachment from this portion over here. This is the zygomatic arch and the zygomatic bone, right? So that muscle comes over here and attaches in this fashion. So it has this sort of arrangement, right? Or this sort of shape. It's a quadrangular muscle. So it originates from the zygomatic bone and the zygomatic arch, and then it attaches on the ramus of the mandible, but on the lateral surface of the ramus. So the temporalis was going to the deeper or the medial part of the ramus, but the masseter is going to be over here and is going to cover most of the lateral surface of the ramus of the mandible. So it's a quadrangular muscle and it has two heads actually. So you can imagine that two of my fingers are one of its head and the third finger is the second head. So there's a superficial head and there's a deep head, okay? So if this muscle were to act on this bone, so among these two bones, the concept that we talked about, that one bone has to be fixed most of the times and the other bone has to be movable. So this bone, the zygomatic arch and the zygomatic bone, is fixed bone of the skull, but the mandible can be moved. So if I were to contract this muscle, obviously it won't contract like this. this bone cannot be pulled down, but the mandible can be pulled in this direction. So that means this would also elevate the mandible, right? Or close your mouth. So it's going to pull the mandible upwards towards the zygomatic bone. And the second function that it would also do, if you look at these fibers, so this probably would be the superficial head. So the superficial head, when it's going to pull the mandible, because this is a little anterior or front of the mandible. So if this were to pull this way, where would this mandible also go apart from going upwards? Yes, you probably guessed it right, that this is going to also be pulled anteriorly or forwards, right? So that would be protracting or protruding the mandible. So it's going to pull the mandible forward and it's going to pull it upwards as well. And it makes sense, right? So even if the muscle is not shown over here, you can see it in the pictures. So again, it's going to be pulled and this mandible is going to go forwards and then upwards as well. So we're done with masseter as well, which sadly is not visible on this model. And the third muscle that we have, our third and fourth muscle, are the pterygoids. So we have a medial pterygoid and we have a lateral pterygoid. And these muscles are usually the difficult ones to understand because they're not easily seen on models or visible or understood. But hopefully this video would do that. That's why I'm here for. So if you look at, so we have to look at the deeper part or the posterior part of the skull. So if you look at this part, so just let me show the orientation, how the skull is being held. So if I were to move it this way, the muscle you see over here, see the front camera is actually coming into work now. I can actually see what I'm showing. So this muscle that we have over here, this is the medial pterygoid. So the way to remember that which one is medial and which one is lateral pterygoid, remember that the medial pterygoid is a mirror image of the masseter muscle. So the masseter muscle was over here, like this, right, on the lateral surface, and exactly like this is another muscle, this one. This is the medial pterygoid. So M for medial, M for mirror image, M for masseter. So it's a mirror image of the masseter muscle. And if you see it, look at it, you can see that it is coming from this bone over here. I don't know if I can show it in the camera. This bone over here, this bone. So this bone is the pterygoid plates of the sphenoid bone, okay? And if you know our general anatomy and the basic anatomy, we know that there are two pterygoid plates. There's a lateral pterygoid plate of the sphenoid bone and a medial pterygoid plate of the sphenoid bone. So another misconception or misunderstanding that usually students have is that since the name medial pterygoid has medial in it, they think that this muscle originates from the medial pterygoid plate of the sphenoid bone and the lateral pterygoid originates from the lateral pterygoid plate of the sphenoid bone. But that is incorrect and that is false. Both of these muscles originate from the lateral pterygoid plate of the sphenoid bone. The only difference is, and I know it's a lot of lateral and medial coming into play right now, but since they both originate from the lateral pterygoid plate, one originates from the medial surface of the pterygoid, the lateral pterygoid plate, and one originates from the lateral surface of the lateral pterygoid plate. That was a mouthful, right? So, but you get the point that both of these muscles originate from lateral pterygoid plate, one from its lateral surface, that would be the lateral pterygoid, and one from the medial surface, that would be the medial pterygoid, right? So this muscle over here, this is originating from the lateral pterygoid plate, which you can see over here. This is the medial one. You cannot see any muscle originating from here. But the other one, the lateral one, is giving rise to this muscle, medial pterygoid. And it's medial part, right? So lateral pterygoid plate, but it's medial surface. I talked like 3 minutes on this. So we have the medial pterygoid muscle over here. It also has two parts. It has a superficial part and a deep part, some people like to call it, or just two parts. So if you look at this muscle, and since it's, since it's a mirror image of the masseter muscle, easy thing to remember is that it will have functions that will mirror the masseter as well. So if this muscle were to pull, let me just see how I can, I don't know, right. Okay, so if this muscle were to act on the mandible, this would also pull the mandible upwards, so that means that it would elevate or close the mouth. And because this plate is a little anterior to the mandible, so this plate cannot be moved. But the mandible, which is posteriorly placed, it would move and bring it where? More anteriorly or to the front. So this is also going to protrude or protract the mandible or bring it forward. So again, two functions, that it elevates the mandible, it protracts the mandible, but since this structure over here, this lateral pterygoid plate, because it's more closer to the midline, that means it's more medial than the mandible. That means that if it were to pull it, it's going to pull it in this direction, medially or towards the midline, right? So towards the midline. Look how the mandible is more laterally and this plate over here is more medially. So the mandible is going to move to the opposite side, right? So the opposite side. So it would also cause it to laterally move in the opposite direction, right? So this mandible is going to move laterally because of this muscle's function. So this is a muscle that is also used in chewing. So grinding motions, right? The rest of the muscles that we did previously, they were closing and retracting the mouth or protracting the mouth. But this muscle also causes grinding movements, lateral movements. That means that this muscle is mainly used for chewing along with the lateral pterygoid. Because when one side's medial pterygoid is going to act, this side's lateral pterygoid is going to relax, and the opposite side's lateral pterygoid is going to act to move this mandible in an opposite direction. So chewing movements. So we're done with the medial pterygoid as well. Okay, so the last muscle that we have over here is the lateral pterygoid muscle, right? And it's difficult to locate this on this model, but I'll still try. Can you see this muscle over here? The muscle that is going towards this joint being the TMJ, temporomandibular joint. So this muscle over here is your lateral pterygoid muscle. So if you view it from this angle, so we know that this was the medial pterygoid, the mirror image of the masseter, and this one over here, the deeper one, is going to be the lateral pterygoid. So this muscle over here is the lateral pterygoid, and if you look at where it's coming from, it's also coming from this bony plate. And we already talked about that this bony plate was the lateral pterygoid plate of the sphenoid bone. So the medial pterygoid was coming from its medial surface, and the lateral pterygoid is going to be coming from the lateral surface of the lateral pterygoid plate. I know that's a mouthful, but it is what it is. So this muscle has more or less a horizontal sort of orientation, that it comes from the lateral pterygoid and then goes straight to insert onto the TMJ over here, right? So this muscle is the lateral pterygoid. So if you were to guess its function, right? So it actually has two heads. It has a superior head and it has an inferior head, or some people call it the first head or the second head. But one of its head, it's superior, upper, and the second head is a bit inferior, so inferior head. So these two heads, one of the fibers or one of the heads, its tendon goes like this and then inserts into the articular disc of the TMJ. So for example, just like my finger, if it can turn, it sort of has this sort of appearance or insertion. So from the lateral pterygoid plate, which you cannot see from this view, it's deep inside, it's going to go straight and then it's going to curl around the articular disc. Okay? The second head or the inferior head, it mainly goes to this part of the mandible, this part over here, the medial surface. So that part is called the fovea or mandibular fovea or the fovea of the mandible. So if you were to guess its function, so the part that is a bit anterior to the mandible is going to be the fixed part, that is going to be the lateral pterygoid plate. So if this muscle were to contract, it's going to, the superior head, it's going to pull it like this. So it's going to pull it like this. What would this cause the mandible to do? This would cause the mandible to open, right? The mandible to depress. So this is one of the muscles of mastication that would cause depression of the mandible. The other three do not do that. So it's sort of special in that sense that it's the only muscle of mastication that is actually going to depress the mandible. The other three were elevating the mandible or closing the mouth. This would open the mouth. So again, contraction, so it's going to rotate the articular disc and the TMJ, and in that manner it's going to cause it to, this TMJ to come forward, and that would cause this mandible to open, right? The second function it has, so the second function it has correlates to the medial pterygoid. So if you see that this plate is more medial than its insertion, so that means that if it's going to contract, it's going to bring this mandible closer to the midline, thereby making this part of the mandible away from the midline. So it's going to cause lateral movements as well. So the lateral pterygoid and the medial pterygoid, they act synergistically to produce chewing movements. So if I were to do like, animals, cows chew like that primarily, but humans do not. Hopefully you do not do that. So the lateral movements of the mandible, they are mainly caused by the medial pterygoid and the lateral pterygoid. The rest of the muscles, the masseter, the temporalis, they elevate the mandible, they protract or protrude the mandible. The temporalis is the primary retractor of the mandible, and the lateral pterygoid is the only depressor of the mandible. When we're talking about the muscle of mastication, there are other muscles acting on the mandible that also act to depress it, but those would not be considered as muscles of mastication. They would be considered as muscles acting on the mandible. Mastication meaning the muscles functioning or aiding in chewing movements. So that was it about the muscle of mastication. The last thing that is left is their nerve supply. So we know that these muscles, they are derived from the first pharyngeal arch. These are among the arches or the pouches or the curves and grooves that an embryo has, or you had when you were a little embryo. So one of those arches, the first pharyngeal arch, gives rise to all these muscles of mastication, and that arch has one singular nerve supply, that being the mandibular branch of the trigeminal nerve. So that's fifth cranial nerve, trigeminal nerve. Its third branch, so V3 is the mnemonic or the symbol. So V3, that is the mandibular branch of the trigeminal nerve, that then gives separate branches to each of these muscles. So there would be a branch to temporalis coming from mandibular nerve, a branch to masseter, a branch to lateral pterygoid, a branch to medial pterygoid. So these four branches are going to be further branches of the mandibular nerve. Okay. If you talk about the arterial supply, so there is one main artery that is going to supply the face and the deeper structures of the face. So we have the facial artery that supplies the face mainly, but over here, the other important artery is the maxillary artery. So the maxillary artery is going to come into this area, and it's going to supply all these muscles of mastication. So before we go off, maxillary artery has three parts: has a mandibular part, has a pterygoid part, and has a pterygomandibular part. These parts are named according to the areas that this artery goes through. So the pterygoid part, or the second part of the maxillary artery, is going to be the part that is going to then send branches to supply arterial blood to all of these muscles. So that was it about muscles of mastication. Hopefully this model helped, the front camera helped, and it was among the better videos. Again, this channel is in its embryological stage, so bear with me. Hopefully we'll get better together. Peace.